This week on Jersey Matters, proms and graduations are a go as the state opens a little bit more. We'll talk with Meg Fisher, Infectious Disease Expert for the Health Department, about that decision and the decision to force nursing homes to take COVID patients. Now you can go to the beach for sun, surf, and a shot. COVID vaccine centers are coming to the boardwalk. Phil Andrews continues his series of reports on law enforcement in the Garden State. And who has the best pizza in all the land? Do you even have to ask? Hello, and welcome to Jersey Matters. I'm Larry Mendte. Now my interview with Meg Fisher, Infectious Disease Expert with the New Jersey Department of Health. Dr. Fisher, thank you so much for your time today. You follow some wonderful news by the governor that the state is reopening a little bit more. Did you advise on that? And what was the information that reopening a little bit more than we were before was based on?
So I agree with you. This is really truly wonderful news for everyone who lives in New Jersey and certainly for the businesses in New Jersey. The governor takes his advice from the Department of Health, but he also gets advice from other places. And what really allowed us to do this was the incidence of hospitalizations has continued to decrease dramatically. The incidence of new cases has been on the down slope for some time. So with that kind of good news, and with the fact that we now have immunized so many people, we really think that it is time to open the state up.
Do you see things improving still? It'll just keep improving? Is that the trend at this point?
That is certainly our hope. We know that we haven't yet vaccinated enough people. We want to continue to vaccinate more and more groups. We want to be sure that the most vulnerable populations have that opportunity. We're trying to make it easier and easier for people to get a vaccine. You can now get a vaccine without an appointment. You can go to a walk-up area in a variety of places. We have pharmacies as vaccinating centers. Every person in New Jersey lives within 5 miles of a vaccination site. So we really have the vaccine out there. Now the question is just ensuring that those people who were, waiting to see what was going to happen and making sure that it was safe, that they are more comfortable now to go ahead and get vaccinated. And we're also trying to make it even easier so that people who have jobs have to be at their jobs. Maybe they have 2 jobs. They don't have the time or the energy to go get a vaccine. So we're trying hard to bring it to them as much as we can.
But it doesn't sound like convenience is the major reason people aren't getting the vaccine. I was at a hospital recently, I won't say which one, but I asked some of the medical professionals there, I said, well, I guess you've all been vaccinated. They said, no, it's running about 50%. And I said, why only 50%? Why only half? And they said, a lot of people are worried about the vaccine. They want to see the long-term effects. If that is the feeling among medical professionals, you might have a real problem throughout the state population.
You're absolutely correct. I think that is certainly one opinion among some medical professionals, but many of the rest of us are very clear that this is a pandemic and that the vaccination is the best way for us to end this pandemic and the best way for us to get ahead of the variants. Of course, the biggest concern is that variants will evolve before we get everybody immunized. So the more people we can immunize, the less the virus will have the ability to replicate, so the less it will mutate and the less variants that will come around. So I do agree with you that there are some physicians, some nurses, some people who work in hospitals who are still reluctant to get the vaccine, but we hope that they also, as they look at their peers and as they look at the leaders in their communities and at their hospitals, the fact that they are all immunized and that they are all still really advocating that everybody possible get vaccinated. So we're hoping that we can change everybody's minds.
Let's stay with the variants for a second. How many of the new cases are the variants?
So we don't know that for sure. As you know, we just test a small percentage of the total new cases to see if they are variants. We have seen over the last weeks to months that the number of variants is clearly increasing. We know that many of these variants are spreading more rapidly. There are studies in the United Kingdom that show that at least that variant is more likely to cause severe disease and get people hospitalized. We've seen a trend toward younger people being hospitalized in addition to the older folks. We're hoping that's because of the vaccine and because older folks now in New Jersey, 85% of our people 65 years of age and older have received at least one vaccine. So we think that's one of the major reasons we're not seeing the disease as much in older folks. Now we are seeing it in younger folks, but they're getting sicker and they're getting sick enough to be hospitalized. So that in itself is a reason for even those people who were hesitant before to think about it again, rethink the situation. We have very good data now, over 100 million people immunized in this country, and the safety appears to be excellent.
Explain the comment you made when you were talking about people getting vaccinated, and you said we hope to get enough people vaccinated before it evolves again, before there's a new variant. Is your concern that there will be a variant that'll be resistant to the vaccines?
Of course.
And that could happen.
Yes, that absolutely could happen. We know that some of the variants reported from other areas of the globe are not as likely to be influenced by some of the vaccines. The South African variant there's some evidence that people who are vaccinated with Moderna didn't respond quite as well. People with J&J didn't respond quite as well. So yes, that is absolutely a concern. And, until the entire globe is immunized, we're going to see these variants continuing to pop up. The good news, though, is that for the variants that are present in New Jersey right now, the vaccines work very well. So I don't want people to be nervous that, you're going to need a booster shot tomorrow or a different shot tomorrow. It's certainly possible in the future you may, but at the moment, your best bet, if you haven't been vaccinated already, go get vaccine.
I just checked the CDC site before this interview, and New Jersey still leads the country with the highest mortality rate, and not just by a little bit. I think it's 288 to 267 for New York. And why is it so high here?
That is a question that I wish I knew the answer to. I think all of us at the Department of Health wish we knew, and obviously all the people in our hospitals wish that they could understand a little bit better so that they could maybe do some different intervention. We know that in New Jersey, over 50% of our deaths have been in older people. Certainly, older people are at more risk because of their other underlying health problems. So we've seen that. We also know that New Jersey is one of the most densely packed states. So our population density leads to people getting exposed more and possibly exposed with higher amounts of virus because of that proximity. We don't know yet if that makes a difference. The simple answer is we don't know. As with so many things about this disease and this virus, we still don't know lots.
You said over 50% were older people in New Jersey, and many of those people, a large number of those people, were in nursing homes and long care facilities. Was the decision to mandate readmission for COVID patients into those facilities a sound one, or did that contribute to the deaths?
At the time that decision was made, now we're talking about last March and last April, I was actually not working with the Department of Health, but I was at one of the local hospitals, and the hospitals were being overwhelmed. We were running out of intensive care beds. We were concerned about running out of ventilators. We were setting up committees to try to decide what we would do if we ran out of certain supplies, how we would decide who gets what. It was really a very dire time. And it was very essential for us to get patients who were recovered out of the hospital. So personally, I think that that absolutely was the right decision at that time, because at that time, we didn't have the luxury of extra hospital beds, of extra hospital personnel. We were drowning, and we needed to have the patients who didn't require inpatient acute care hospitalization. We needed them to go back to their centers and be taken care of there.
It was interesting how you answered the question. You said it was the right decision at that time. And I realize the panic of the situation and how little information there really was. Retrospectively, was it a good decision?
So that's a very interesting question. What we know as far as how contagious people are, we know that they are contagious a little bit before they get symptoms. The most contagious right around that time of the symptoms. And then by 10 days, the vast majority of people are no longer contagious. So if you have a patient who's been in the hospital for 4 weeks, they're not contagious anymore. So it is absolutely appropriate to send them back. And most of those patients who were going back to long-term care had been hospitalized for weeks, because they were people who had underlying problems and got very sick.
But doctor, the statistics of the 5 states that had that mandate of readmission have higher rates in their nursing homes than most of the rest of the country. So there has to be something involved. And this is not, believe me, this isn't to place blame. I realize everybody was building a parachute on the way down and trying to figure out. But you still stand by that decision then?
Yes, there were outbreaks in long-term care. Were those outbreaks because of people coming back into the system, or were they because the people who worked in those centers, even trying to use proper PPE, and remember, we didn't know about personal protective equipment very well back in last March and April. So were they using that appropriately? Did they get the disease when they were in the community and bring it into the long-term care? We know now that definitely is happening. The CDC has reported several outbreaks where it's from unimmunized staff who are bringing the virus in. And then fortunately, most of the staff have been, or most of the residents have been immunized. But remember, a lot of these people are, again, older. They may be on therapies that suppress their immune system, and they may not respond as well to the vaccine, certainly as their younger staff would have had they chosen to get it.
Well, I'll leave you with this, and you can comment on it if you want to, because it seems, much of it seems political to me, is that the people in society who most think that we should be open and stay open and open up everything to everybody are the people that are most resistant to getting the vaccine, when it seems like the vaccine is the answer to reopening. Do you want to comment on that, or do you want me to just leave it with that?
I think it's an interesting and perplexing problem, and I don't disagree with you at all. And I hope that we can eventually change the minds of at least some, if not many, of those people. So I'm optimistic. I'm the eternal optimist, and I hope that we are going to get most of New Jersey immunized. And as the vaccine expands to younger people, we'll also be able to get our children and adolescents protected.
And we should end with that. Doctor, thank you so much for your time. Dr. Meg Fisher, infectious disease expert with the New Jersey Department of Health. Coming up next on Jersey Matters.
Pretzels, popcorn, COVID-19 vaccine. Coming up next on Jersey Matters, we'll hear from an assemblyman who would like to bring COVID-19 sites right here to our Jersey Shore boardwalks.